Hi there, my name is Chuck Miller. I'm 79 years of age and have prostate cancer. My PSA numbers were very high, and on March 7th, the biopsy readout showed that I had, from the 12 samples, 6 areas of the prostate that were cancerous. At least 4 of them were 9 on the Gleason scale. Therefore, I got a bone scan, an MRI, and our nephew who had had prostate cancer 12 years ago took me to his doctor to get their opinion and see what steps we should take. I was told I would need 2 years of hormone blockage, and 2 months into it, 5 to 9 weeks of radiation treatment. We walked away aware this was plan 1, didn't know that there was a plan 2, and progressed down the road considering that option. A friend of ours called mentioning an alternative doctor that had helped her get through stage 4 breast cancer following a double mastectomy. We got an appointment with this doctor, a PhD who would say I'm a scientist, not a medical person. We met with her. At the very end of that 3-hour time, she handed me a folder and said, "See this folder? What I want you to do is go see this doctor. He's an MD who treats cancer naturally. He just set up an office in Newport Beach in November of 2013. So on April 11th, we were in his office, my wife and I, and the nephew, who's retired military intelligence and a very thorough researcher, was with us. We listened to Dr. Nezami, raised all of our questions, enjoyed his openness, his willingness to hear us. We didn't feel he was trying to push us or sell us something. And then we were very stunned when our nephew said, "Chuck, if this was available to me 12 years ago, this is what I would have done." That was so out of character for him to say, because he's a very thoughtful, research, careful when he speaks person. Therefore, my wife and I and the nephew spent some time talking, raising questions alone with one another, praying, and then felt this was a step we should take. So on April 11th, the blood was drawn. On Friday, April 18, I began the treatment. The doctor came in and said, "I have good news and I have bad news. Which do you want first?" So I said, "Let's have the good news." He said, "Well, you do not have cancer in your bones and in your blood." That was wonderful news. The bad news, you do have cancer in the prostate. I said, "Bad news that I have it, or bad news you can't treat it?" He said, "No, we can treat it." And so I began the therapy 4 days a week, Friday, Saturday, Sunday, Monday, for 8 or 9 weeks. During this time, I went from having very little energy. My countenance was, as different friends said, really gray, to my countenance got brighter. My energy began to return. after about 4, maybe 5 weeks, I was walking about 15 to 20 minutes a day. After 8 weeks, I began to walk 30 minutes a day, every day. So I am very, very grateful about now 9 or 10 weeks into treatment at all the progress I've made. I'm grateful for the relationship with Dr. Nezami. We can laugh, we can ask questions. He listens to me and how I'm doing. A friend of mine, again, who's very careful to not overstate something, said to me recently, "Chuck, I saw you in March and April, and now when I'm with you today, the change in you is really a miracle." That's how we see this. We're just very grateful to have this treatment provided. And we feel that I'm really on the road to recovery. I've been able to be in my office. I was on a conference call 2 days ago for 2 hours, was consulting. My brightness has returned, my energy. I'm just very, very grateful. So I would encourage anyone with cancer to at least look into this kind of treatment. It may be just the right treatment for you. I'm grateful that it's become that for me. So thank you very, very much for giving me the opportunity to tell my story. I hope it will help maybe the story of others.